Good day, ma'am. I'm Rodeline J. Manera, your student nurse from Level 3, Section 2, and today I will be having a video recitation about the Buerger's disease. And prior to explain everything that I've learned during the lecture session is to blindfold myself first po. Okay, so when we say Buerger's disease po, it is a rare condition or disease that is most often found sa mga taong nag-i-smoke. So, the blood vessels in the legs, arms, and feet and sa mga affected is sa mga affected area is nagiging inflamed, which makes the blood hard to travel through, so nagkakaroon ng reducing ng blood flow. So this clots makes the issue worse, so leading to pain and nagkakaroon ng tissue damage. So it primarily affects the small and the medium-sized arteries and the veins and the extremities. So ang ating risk factors here is yung yung pagkakaroon ng smoking cigarettes, and then common siya sa male, and dahil sa chronic gum disease. And ang ating pathophysiology is simple lang. So, based siya sa nabasa kong article. And so, the initial step in the Buerger's disease is dahil siya sa pagkakaroon ng damage sa inner lining ng blood vessels, which is known as the endothelial cells. So, yung damage na to is natitrigger siya by various factors, which is yung nasabi kong mga triggering factors like the tobacco smoke, or nagkaroon ng infection si patient, or there is an autoimmune responses. So, this damage or the endothelial damage leads to the inflammatory response. So, which is characterized by the infiltration ng immune cells natin, particularly yung sa neutrophils natin sa may affected blood vessels ng patient. So, the presence of this inflammatory cells and the release of inflammatory mediators contribute to the narrowing and the inflammation of the blood vessels. So, yung ongoing na inflammation sa may Buerger's disease is nagko-contribute siya sa formation ng blood clots or yung tinatawag nating thrombi na nandun sa may affected blood vessels. So, yung clot formation can be a result of increased platelet aggregation and the activation of the coagulation cascade. So, as the thrombi develop, they can partially or completely obstruct the affected vessels, which is naglilid siya sa reduction or nagkakaroon ng complete disruption ng blood flow. So, yung occlusion na to is primarily naapektuhan niya yung small or yung medium-sized na arteries and the veins na nandun or nakalocate sa extremities natin, like for example, I mean particularly sa hands and the feet. And the obstruction of the blood vessel results sa ischemia. So, the deprivation of the oxygen and the nutrients to the tissues. So, yung ischemic state is nagkakause siya ng pain, and especially during exercises or activity. So, ito yung intermittent claudication. So, and it also lead to tissue damage. So, the affected tissues may experience slow healing and ulceration. So, but in some severe cases is nagiging gangrene siya or nagkakaroon ng formation ng gangrene. So, in addition to the thrombus formation, the Buerger's disease is characterized by episodes of vasospasm, which is ito yung sudden constriction ng blood vessels. So, yung episodes na to can further reduce the blood supply sa extremities and can exacerbate tissue damage. Now, Buerger's disease is characterized by a cyclical pattern of the inflammation and healing. And the inflammatory response is naglilid siya sa further endothelial damage, thrombus formation, and occlusion, which perpetuate the condition. And over time, yung pattern na to, if yung pattern na to is ulit-ulit na nangyayari, this can result to the development of the collateral blood vessels, and it attempt to bypass the blood or the block vessels, and nagpo-provide siya ng alternative blood supply to the affected tissue. So our signs and symptoms here is, yun nga, nasabi ko na yung pagkakaroon ng intermittent claudication, which is yung nagkakaroon ng pain or discomfort sensation which occurs with exercises. And nagkakaroon ng cold sensitivity, and the patient will experience tingling or numbness sensation sa may hands and the feet, and muscle cramps. So, halos same lang sila ni Raynaud's disease. However, ang pinaka-difference lang nila is the location of the affected areas. So, kapag sa Raynaud, ang affected dyan is the fingers and toes. Dito naman is the hands and the feet. So, our nursing intervention here is i-encourage natin si patient na wag siyang maglakad barefoot, kasi nga, syempre may ulceration na nga. So, ma-aggravate palalo yung wound niya. And also, i-encourage din natin yung pag-use niya ng lanolin lotion that will prevent the feet and legs for dryness. And i-encourage din natin siya ng well-fitted shoes. And our medication, our medication here is the antiplatelet or anticoagulation, coagulant, sorry. And then, analgesic, and yung specific medicine is the uh, ano yun, pentosiphelin. Hindi ko alam kung tama po ba, basta pentosiphelin po yung medication, if I I was right. Yun po yung natatandaan ko. So, I don't know. Correct me if I'm wrong na lang po. So, that's it for our Buerger's disease po. Thank you.